Okay, very good, very good. Have you ever been to an emergency department? Or maybe you have read the news about overcrowding and patients having to wait 9, 10 or more hours until they can see a doctor. If you have, then you are already aware that healthcare in Sweden, just like in the rest of the Western world, faces tough challenges when it comes to demand, capacity, and economy in healthcare. The task is to, in a good way, provide healthcare to an increasing number of people with more and more complex diseases. And emergency care, it is the front line of the healthcare system. It is a critical societal function and a hub which a majority of the patients flow through. We have in Sweden 3 million emergency department visits every year, and approximately 1.7 million ambulance dispatches, and many times more urgent visits in the health centers. And these numbers, they are only increasing every year, which is an international megatrend that has been going on for more than 25 years. And the consequence of this, it is that if you build an emergency department today that is adapted for the current needs and demands, then it won't take long until that emergency department is completely overcrowded. And that means there is a constant pressure on healthcare providers all the time to optimize their flows and improve their logistics and to do things in a smarter way. But in emergency care, this is no easy feat, because emergency care can be somewhat chaotic. It's characterized by complex flows that stretches across all of these organizational borders. It can, for example, start with the phone call to the emergency number 112 to the dispatch center, and then comes an ambulance that triages the patient and starts treating the patient, who then maybe is transported to an emergency department or directly to a ward in the hospital or maybe a health center. And each of these organizations, they have a lot of own equipment and systems, and they don't communicate with each other. So that makes it very difficult for the healthcare professionals to coordinate their work, and there is a substantial risk of losing information in each of these handovers from one step to another. We are currently in a trend where young, innovative companies are driving change in healthcare. There are many examples of this where startups have introduced smart e-health solutions in elderly care, for example, and primary care and other areas. But in emergency care, this need is even greater. Recent studies have shown that healthcare professionals, they spend a third of their workday in administrative tasks, which includes double documentation, triple documentation, and sometimes just searching for the information that they need in order to perform their job. So what if there is some way that we could reduce the time each of these patients have to wait, and to free up time from the health professionals from these administrative tasks that doesn't bring any value to the patient? Even if you could just do small improvements with the volume of visits, there will be great benefits. And that's where we come into the picture. Because we at Aweria, we are experts in e-health for emergency care, and we have accepted this challenge. We have developed a platform that solves this problem by having a holistic view of emergency care, and by connecting the dots and creating a structure in this somewhat chaotic flow of data and events. Imagine there is like a digital assistant that follows the patients all through the whole emergency care chain, from the site of the accident, in the ambulance, and in the emergency department. And this assistant takes notes of what has happened, keeps track of the vital parameters of the patient, and records all the actions of the health professionals. And instead of the patient having to repeat the information about their condition for every new person they meet, the assistant will take care of that. And also, the assistant gives medical advice to the doctors and to the nurses about what to do. This is basically what Aweria does. We provide line of business applications for doctors, nurses, and paramedics that work in emergency departments, ambulance, and health centers. And these applications, they can be run on PC or in iPad. And the system helps the health professionals to cooperate and to coordinate their work. And it has built-in decision support systems that help them to make fast and accurate decisions. Aweria's unique artificial intelligence and flow simulation software, it helps to find the bottlenecks and to optimize the logistics in the emergency care processes. So then we have both ambulance and emergency department flow in one and the same platform that can be optimized. And the result, it is a more efficient emergency care, increased patient safety and quality of care. We are currently, as a startup company, we are currently in an intense development phase in a series of deployments where our first step has been to focus on the emergency departments. But in the next year, we have rolled out the whole platform that take care of the whole emergency care chain. And this is a unique solution that has huge potential for efficiency improvement. Our customers, they have conducted studies that if you add up the result, it indicates a potential of freeing up resources worth more than 2 billion SEK every year. And this is a number that only will increase when, with the help of the system, we can discover smarter ways to design your emergency care processes. And with the system now up and running in 10 emergency hospitals, we have reached an important milestone where we as a startup company have proved that we are capable of delivering top-of-the-line IT solutions for a critical societal function such as emergency care with the high demands that on robustness, stability, and security that is required of such a solution. So we are now working intensely to deliver something that has never been done before. And our goal is to be #1 in the Nordics, where we see many possibilities for Aweria to be able to help improve a significant part of emergency care in the coming years. So if you think this is an interesting subject, then you can check out our website, aweria.com, or check out our LinkedIn page, where we all the time update with news about what we're up to. And there will be some super exciting stuff coming out in the next few months. And also, if there is any investors here in eHealth, we want to talk to you, because we have some really cool plans for the future that you might want to hear about and possibly be a part of. So feel free to contact me, and we talk more about the future, about eHealth for emergency care. Thank you.
Excellent, and I think it's excellent that you're paving the way as it is to this networking thing and actually calling out on the investors to come and find you during the break. I think it's good. You're using the platform.
Yes.
And I think it's really interesting because a lot of the times when you hear about new ideas, new products, they're not always implemented. But it's in use in 10 emergency hospitals.
Yes.
So what have you found what were the challenges when it comes to implementation? What hurdles have you managed to get over?
Well, traditionally, I think the public healthcare has been a little bit hesitant to implement new solutions in like those critical functions like emergency care. And this is something we had to learn how to navigate through. And nowadays, I think everybody agrees the importance of implementing smart e-health solutions in all parts of care, including emergency care. So this is something that is improving all the time, and now we see it's much better.
So is the healthcare system learning to embrace you?
I think so. And a good approach to implementing them is smaller, agile projects.
Good, good. And what are the reactions you've got once your product is in place? How do they respond to it?
Well, overall, the customers are very positive. They are very positive. We get really good feedback. And, you know, it's very stressful work in emergency care. There's a lot of going on. And if you don't have a system like this, you have to keep track of a lot of things on your own. And so for me, it's very nice to hear when the nurses come and say that now that Aweria helps them keep track of their patients and what to do, they feel a much reduced stress in their work. So it's much less stress for them in their everyday work today. So that's it for me, very good feedback.
And I think it's important that you're addressing something here that quite often when we talk about new technical solutions, and there's a lot of companies out there who make a lot of money by producing reports on how efficient it's going to get and how much money you're going to save on this efficiency. But you're addressing another issue here, the work environment for the people working in the healthcare system. And as we heard from Ulrika earlier, that people are actually leaving their jobs because they're too stressful. And if you can address and say that solutions like these may reduce work stress and
it does, yes,
better the work environment, it's another important issue, I think.
Yes, indeed.
And could you say something more about how you actually reduce have you actually measured how much you reduce stress, or are there any results on that?
We haven't measured that, but we have measured how we free up resources in the emergency care chain. And our customers have conducted studies that, for example, just when the ambulance arrives with a patient to the emergency department, and maybe still in many places they use pen and paper, and they have recorded on the pen and paper out in the ambulance. And then when they arrive, they have to spend 10 minutes just to document what they already have documented in another system. So that's 10 minutes just there. And then it's many of these small efficiency improvements, many small moments like this, where the doctors don't have to find the lab results because they come immediately in the system and stuff like that. And in the end, they add up, and that's why we free up a lot of resources. Yeah.
Excellent. It's really interesting to hear about, and thank you very much for
Thank you.
being here and presenting it.
Thanks.